coronavirus pandemic has its many stories of origin, escaping from a lab in Wuhan, China, also from the wet market or animal market. Whichever the plot is, zoonotic diseases and COVID-19 is a worry for the veterinary world right about now. You can tell us about it. Now, they are considering the possibility of mutual transmission between man and animal. And to ensure total victory over the disease, it is key and very so expedient to factor in pets as well as other economic animals such as cattle, goats, ram, poultry, and a host of others in the country. The Veterinary Council of Nigeria, a body charged with the responsibility of coordinating and overseeing the practice of the profession in Nigeria, is up and doing. What are the extra worries in the management of the global pandemic as we handle our livestock, being generated from the practice, care to slaughter, and also ultimately to your plates? My guest is well versed in this field, so we'll find out more. Welcome to the program. My name is Blessing Abu. Now, my guest holds a PhD in veterinary epidemiology from the University of Plymouth. That's also, and she's also a doctor of veterinary medicine from the Ahmadu Bello University, Zaria. The first veterinarian to actualize the integration of Sniff dogs into the national security architecture while serving as officer in charge of the veterinary of the presidential villa in 2005. She was recognized by the UNESCO as a pearl among women in the field of science. On the spot today is Commissioner of Police and Head of Nigerian Police Force Animal Branch, Abuja, and she's the first female president of the Veterinary Council of Nigeria. So it's my honor to welcome to the program Dr. Aisha Buhari, Baju. Welcome to the program.
Thank you, Blessing, for having me.
We always love it when we have the first in this area. And as a woman, congratulations, we want to say to you.
Thank you.
Yes, this appointment was recent, so we want to share some of those ideals. This is not a new area to you. It's your field. But then the global pandemic is bringing on so many things, and yourself, as well as colleagues, veterinarians, are actually worried about the management when it relates to your field. Tell us about this.
The pandemic, you know, everybody knows that it started from the wet market in Wuhan, and it's a place where you have a variety of animals being eaten raw, sold, and rest, and that's where it came about. So what it's telling us is that this disease, the pandemic, comes from animals to man. Now, when you look at it as veterinarians, it gives us a lot of concern, and it should give everybody concern. For us in veterinary practice, coronavirus, that's where the COVID-19 virus is a family from the coronavirus. We are very conversant as veterinarians. We are very conversant with the coronavirus because it causes a lot of diseases in animal species. So when it jumped species from animals to man, then there is need for everybody to put hands on deck to work together to find how we can go about handling this pandemic. You know the issue of zoonosis, that's diseases that are being transmitted from animals to man, from man, and vice versa. Although up till now, it's not documented that COVID-19 is pandemic, but there is zoonotic potential to it.
Even when it was declared as a pandemic by the WHO?
Yeah, pandemic means, I mean, it's worldwide, it's a global issue.
Okay.
Yeah, but what we're talking about is the zoonotic part of it.
Okay.
I just defined what zoonosis is. That there is transmission between man to animal, animal to man. You know, that's where the problem is. As it is now, although it has jumped species from animal to man, there is that link from man to animal and back again as COVID-19 has not been documented yet. But the transmission from human to man has been documented. We have the case in cats, dogs. Of recent, we have in the tiger, in the Bronx Zoo in New York, and so many others. So that gives us a lot of concern. And very recently as well, we have the employees of major beef and pork product industry in the US being closed down because majority of the employees in that industry were tested positive for COVID-19. So that should give us a lot of concern. So indicating that there might be likelihood of zoonotic potential of COVID-19.
Okay, so for us as a nation, where are the risk factors? Because we, like I've already pointed out, people keep pets here.
Absolutely.
We have economic animals.
Yes.
From the north to the south. People keep them in large numbers.
Yeah.
And it's not out of place that we have markets, slaughter places, abattoirs, where humans, of course, work. And directly these animals could have been, and with people coming down. So your concern as a council for the practitioners looking into dump some of these areas, where are greatest risk factors that we've seen today?
Well, on our own part, we try to be proactive, even though we kept drawing the attention of government of the zoonotic potential of the COVID-19, and that is why we call on government to at the level of working. There's a working group on the COVID-19. There's the PTA from the Presidential Task Force to all the state task forces. We advised government that veterinarians should be involved, should be included in these teams, so that we should be able to work together, because when you are fighting a disease, it should be multidisciplinary. However, the last time we were at the FCT, we paid a courtesy on the Honorable Minister of FCT, and we made a case, and immediately he gave approval for veterinarians to be included into the FCT EOC on COVID-19. We have written to PTF, they have also responded. We are still interfacing on the possibility of that. However, as I said, on our own part as veterinarians, we try to be proactive. You don't have to wait for government to say, oh, you are part of a committee before you do your professional responsibility.
But you see the risks very high in these parts of the world, because at least in our own nation, the possibility of mutual transmission from man to the animals.
It's very possible. It's very possible. But as it is now, as I told you, you know, science is about documenting and evidence. You cannot just say, oh, it's zoonotic. You have to document it, that this disease can be transmitted from animal to man and vice versa. So far, we have seen transmission from human to animals. Okay. It is that link that we have not seen, but we cannot rest and say, oh, we are waiting until we see that. So that is why we put in a lot of things on our own part as professionals to see how we will counter this just in case. And that's why we have some measures. Now the Veterinary Council has launched what we call decontamination program of major livestock and live birds markets across the federation.
All over?
Yes. Decontamination of also abattoirs, to ensure food safety, as well as other animal-related areas. So these are ways that we think we can also support government effort in the fight against the pandemic.
All right, Dr. Abubakar Baju, but for you as a practitioner and also colleagues practitioners, I wouldn't know how much of visitation you go before this pandemic, anyway, from time to time to the abattoirs, to markets. It will worry you if you're a frequent abattoir visitor to see the kind of places. I don't know how much of enforcement of cleanliness and some other area of enforcement of what it should be that you have taken into consideration, because our worry mainly that sometimes even the way the meat, or whether maybe poultry or livestock itself, is being moved, it's worrisome. Absolutely. And also it's not neat enough. The sanitary condition, it's appalling. So how do you step into that, especially now that we have this on our hands?
Well, statutorily, it's the responsibility of the veterinarian to ensure food safety, that wholesome meat reaches the consumer. So normally, even without the pandemic, veterinarians are deployed to abattoirs to ensure that...
How often?
It's routine. It's routine all over the place. It's routine. Wherever you see an abattoir, there's always a veterinary doctor, a veterinary surgeon in that abattoir. That is part of our statutory responsibility, public health aspect of it. So it's our normal duty. generally. However, because of this pandemic, as I said, that is why we try to put some other effort in place, so that we will be able to suck up. All even suya sellers and all this, we have to, it involves a lot of talking to them. You know, sometimes somebody can be infected and he can easily sneeze onto it. So there's a lot of issues. But when you talk about the state of our abattoirs, of course, yes, we as a regulatory body or as a profession, we can only advise, because it is also government responsibility to ensure that the right structure is in place.
And talking about the right structure, it's the first time a woman is heard in the council and say we could be firmer to do our duties as women. But then the extra touch is that is a law enforcement officer that is in charge now. What do you make of the enforcement level, either for taking over, and what are your goals to addressing that?
Before I became the president of the council, you know, it's an election. Part of my objectives, my campaign objectives of what I want to do is to enforce laws. Yeah, we have a lot of laws looking at these things. So we want to enforce these existing laws and also amend some of our laws that do not, fall into what we have currently. So these laws, there are different ways of doing it, but we're trying to work as we just took over. It's just barely 2 months as we're taking over to implement some of our campaign promises that we made. Then came the pandemic. But I can assure you that the council is working very hard to ensure enforcement of all our existing laws. Okay.
Dr. Aisha Baju, we're looking at a break at this point to let you take a breather. Okay. When we get back, more about what the council is doing to help in the management of COVID-19, as well as other things they need to know about the council and how Nigerians can keep safe alongside their animals and their meals, is what we'll be finding out from you after the break.
Thank you.
You're watching On The Spot, and my guest is the President, Veterinary Council of Nigeria. She's also a Commissioner of Police, and you'll get to find out more about what the council is doing in terms of COVID-19 management in their field. We'll be right back after this break.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Yes, welcome back. If you just joined us, the program is On The Spot, and I have the President of the Veterinary Council of Nigeria on set. Let's push further with what COVID-19 management has been with the profession. Our Nigerians also are known to be lovers of animals, so some of them are kept as pets, and some have already gone into businesses with the economic value for such livestock. For those who are having animal farming as a profession, what are the precautionary measures you'll be giving them at this time? For some, they have to actually we know of the herders moving up and down the nation, and we also know of those who try to keep them in their backyards, but safety for the environment is what counts.
Yes, very important. Like we just celebrated the World Veterinary Day, and the theme for this year has to do with protecting environment for animal and human health. You know, we have to do a lot of advocacy. It's quite difficult, especially with the nomads that move around. We're looking at sensitization. We have been talking to our veterinarians, because normally in every farm there will be a veterinarian that is consulting, that is taking care of those animals in a poultry farm and what have you. The message from the council is that ensure your safety, the safety of your client, and also your patients. So that once our veterinarians get in contact, maybe even those people that have companion animals. So when we come to the clinic, these are the messages. If you are in self-isolation, for instance, for any reason you are in self-isolation, we advise that also keep away your pet so that you do not contaminate, because we have seen it documented that you can easily transmit such. So you keep also your animal, as you keep yourself indoors, you also keep your animal indoors so that it does not get contaminated or infected. So all these measures we've put in place to enlighten our colleagues so that they will now also, once they get that, they now put it forward and make sure that...
But what has been the response so far, at least within this period?
Amongst the vets or among the farmers?
Amongst the vets, also for farmers.
Among the farmers, we've been working very closely with them. We've gotten messages across to them through our colleagues. And we've also supported them during this very difficult time. Because one thing is, in the confusion of the lockdown, we try to remind the government, although Mr. President has also made it very clear that you should allow essential services, animal and agricultural products to move freely. But we've gone ahead, for me as a commissioner of police also, to work closely with the police force management to ensure that we make seamless movement for them so that they will be able to move their product, so that they will not lose so much during this pandemic. We have enlightened our police officers also to understand the need that they should allow free flow of animal and animal products, drugs and vaccines and what have you. So we've tried to support them with their business as well as with their health, so that we communicate to them as we get to their farms, we enlighten them further. Okay,
I like the fact that the sensitization is going on fine according to how you have laid it open. Yeah. Now, we know vehicles are transporting animals into boundaries, into states. Could there be extra caution from the council to actually have some of your men or women, as the case may be, at this boundary posts, to actually look into possibility of animals that are unwell moving alongside other ones and infecting, perhaps?
Already we have the national quarantine services. Okay. The quarantine service itself, that is its statutory responsibility. And we have veterinarians. The head of the national quarantine service is a veterinarian. We have a lot of veterinarians in the council, and they have control posts across the federation on major federal highways. Okay. So those control posts, the role of the control post first is to provide services, whereby when you come with a truck, maybe you've traveled all the way from, let's say, Taraba State, you want to go to East. So there must be a control post where you will stop by. And the essence of that control post is for the animals first. We are worried about animal welfare issues, so that the animal does not travel for too long, and by the time it gets there, it is weak, it has lost condition.
What is the longest time frame to take an animal on a trip? What are your established data on that?
Established data, we look at like 7 to 8 hours. We should be able to have somewhere to rest. So that place is for animals to rest. They will provide them with feed. There's water supply there, and there are veterinarians posted to those quarantine control posts to check on the health of the animal. That's for disease control also. So even without the pandemic, it is a routine that we do. So they stop, check the animals to ensure, or is there any dead one, or is there a sick one? We check if it's something. If it's not a serious thing, we handle. If it's a serious issue or there's a disease that is of public health concern, it is also taken care of.
So where are the other worries for veterinarians and also the council generally for your people in discharging their duties effectively?
Well, as I said, we keep talking to them. Of course, yes, there are a lot of challenges.
Just like we want to know those challenges, because why we always feel you are not there doing the job is because we don't get to see some of this enforcement when they come into place. People just, okay, it's just the way with Nigeria, and it shouldn't be.
Sometimes you never know what somebody does until when you're really involved. It's just like a policeman, somebody say, oh, the police are not working. And then I've got some of my friends, sometimes they call you middle of the night and say, I've got armed robbers at home. What can you do? I say, just give me 2 minutes. And they are sitting, before you give me the address, everything you have there, before 5-10 minutes, police are there. I say, oh, really? Police are working? I didn't know police are working. So these are some of the issues. If you don't go to the abattoir and you know if you talk to an average butcher that works in the abattoir, he will tell you that he knows that veterinarians are there and they are doing these responsibilities. However, the concern also are, of course, in terms of the welfare, is general what happens. Like in this type of pandemic, we expect that also as the government is taking care of human medics as frontliners, veterinarians should also be looked upon as frontliners. They are also exposed to a lot of dangers, a lot of risk, and all this personal protection equipment should be extended to veterinarians in discharging their duties to ensure that they protect themselves and ensure public health. Okay.
For medical doctors, I know they want, okay, these are the symptoms for their own patients once it's about COVID-19. Yeah. For your patients, that is the animals now, what are those symptoms people should actually, for those who have, you call them now, companion animals. Because yes. I heard that when you said that, so companion animals, pets, and all of this, what should the people watch out for? Especially for those you know that are kept very in the country. You
know, as we said, this is a new disease, and we've just had very few cases in animals. But scientists, vets are still working. Scientists are still working to be able to say they are bringing out what you expect to see in animals. However, like the case of the tiger in the Bronx Zoo, I spoke with my colleagues in Bronx, because at one time I was a guest speaker there, so I know them. So immediately the case came up, I gave them a call so that it won't be that kind of false media. So we spoke and I asked them, okay, what signs? They say, what they said is that the tiger was showing symptoms almost similar to that of humans. But until we document, and over time we'll be able to know what are the signs. We will also expect them to show some respiratory symptoms.
Okay, but basically we should just watch out for such
yes, and now last time we flagged off the decontamination exercise in FCT, where the Honorable Minister of State, FCT, went there to flag off, and one of the things we discussed is for veterinarians to also go into research, and even if it's just random sampling of these companion animals, especially pets owned by people that have tested positive or they're in self-isolation, we can test them and also see and watch them. Okay. So those are the things we want to do, really.
Yes, quickly, I know we must go now. Sniff dogs were your idea at the point. Yeah. Tell us the value that's been added in terms of security. A lot. I can tell you, Blessing, if the dog, generally, the olfactory organs, that's the organ of smell in dogs, is over 1 million times that of man. Ooh. Yes. So what you can smell, the dog can smell it 1 million times. What you cannot smell, let's say, for instance, you conceal an explosive in a suitcase, or drugs, or currency, whatever it is. And you can easily pass the suitcase. You wouldn't know because you can't smell it. But a trained dog, it is not just any dog. Exactly. I want you to understand that. No. It is not a trend, because training involves using the natural instincts of the dog. Because naturally, the dog has natural instincts of smell. So we now work on that natural instinct to develop it extra and expose that dog to frequent, what we call imprinting on that particular substance you want the dog to sniff. So the dog you keep, and then you can see, I'm sure when you travel, you see that a dog will pass by your suitcase and you just go and grab it, because it can smell that substance, which it has been trained on.
Millions in micrograms of the quantity. In fact, sometimes you see that a dog that is trained to indicate on drugs will just go and indicate on currency, on money. And you begin to wonder. The truth of the matter is that that currency or the money must have been touched by drug handlers. So they must have left certain particles of the drug on it. So it has given a lot of then explosive. Now that we have issues with terrorists using IEDs, explosives, and the rest. So we train this dog to be able to detect. If you conceal it, the dog will be able to tell the handler that there's something in
Commissioner of Police and Head of Nigerian Police Force Animal Branch, Abuja, and also first female president of the Veterinary Council of Nigeria, Dr. Aisha Abubakar. Baju, thank you very much for coming on the spot.
Thank you, Blessing, for having me.
Thank you for your insights.
Thank you.
And the brilliant mind. And we wish you and the board a very fruitful time.
Thank you very much, Blessing. Thank you.
Okay, we also appreciate your time with us. And next time it will be with another interesting guest on the next edition of the program. My name is Blessing Abu. Goodbye.